Hi guys. Okay, so let's do the lab final really quick. We're flying through it. So, review, final, lab. Again, this is all because of Joan. I cannot take the credit, so let's go over it. What is the pH of human blood? 7.35 to 7.45. What is it? Is it more acid or base? It is more base. What are three lung sounds where anatomic locations to best hear it? You're going to have the rhonchi, upper, front, back, wheezes, upper, front, back, and rales at the base. Name the three fluid compartments and which compartment you draw blood out of. You know them, but where you're going to draw the blood out of is the extracellular fluid compartment. Two organs most involved in acid-base are your kidneys and your lungs. What's a crystalloid? Normal saline. What's a colloid? Blood. Again, you give colloids when they're hemorrhaging. Why not give a COPD patient high levels of oxygen? It decreases their respiratory drive. Okay, FiO2 is fractured inspired oxygen. What is the percentage of oxygen in room air? 21%. RAD is an abbreviation for reactive airway disease, another fancy way of saying asthma. Why do peak flow readings? It's to help those that have asthma. The max amount of liters you should use with nasal prongs is 6 liters. Is the end product of metabolism acid or base? It is more acid, more acidic. Which way does the head tilt for an NG tube insertion? You're going to tip it forward. Remember, you're going to have them tip forward, you're drinking, and you're inserting it, and it sucks, but it helps people a lot. What must be observed before a Foley balloon is blown up? You should see urine in the tube. Urine return is what you say. When to read PPD tests? About 48 to 72 hours. And then what are you looking for? You're looking for vesiculation or vesicles. So if it's like red, you're not really looking for it to be red, or you're not really looking for an indurated area. You're looking for a vesicle. Wow, excuse me, sorry. EKGs. EKGs are pictures of electrical activity of the heart. Things a nurse will observe first thing on the shift when assessing the IV that is on her patient. So you're looking at your patient's IV. What do you see? You're looking for the right medication is hanging up. You're looking for the tubing that's going good. So basically you're starting from the medication to the tubing to the vein. Right medication, right tubing. It's intact to the IV. The IV looks great. It's intact. Everything looks good and clean. If anything looks wrong, then that's not good. But that's what you're hoping to find. Is all good. Name things that would indicate the IV needs to be discontinued. Your patient's vein is red. There's streaks up the arm. They're complaining of pain, redness, and swelling. If it's leaking, I felt really bad one time. I had a patient. I didn't realize anything was going on. I was on night shift. And in the morning when I was doing the rounds, or like the bedside report with the other nurse, she goes, oh my gosh, I think it infiltrated. And this poor woman's arm was just like heavy with fluid. I was like, oh my gosh. And she didn't even like know. She was, I don't even know. Anyways, though, it just gets absorbed. It's just kind of like slow. Like, have you ever seen those weird like donut forehead things that people used to do? It's really weird. It just gets absorbed. Anyways, though, okay. So you're going to be looking for basically just things that are wrong. Redness, pain, swelling, all things that need to be discontinued. So name 3 abnormal lung sounds and what the pathophysiology they present. Again, wheezes, rales, and rhonchi. We've talked about it. Yeah, look at that. Don't worry about it. Okay. What is the dub and the lub? Dub, ventricular diastole. Lub, ventricular systole. PEG, percutaneous endoscopic gastrostomy. Okay, so there's going to be a little trick question on there about the percentage of liters of oxygen. Remember, 1 liter is 4% increase. So if you're normally at 21%, I'm giving them 2 liters. That's going to be an extra 8% on top, a total of 29%. Read the question carefully. Let's see here. Minimal amount of urine per hour before kidneys start to shut down. 30 cc's, 30 mils. Acid-base problems again will be on the test. I think I'm going to put them on there for you. Maybe. Anyways, you know how to do those. Okay, when inserting an NG tube, name 2 ways a nurse can tell if the tube is not in the lungs. You're going to listen. You're going to have You're gonna pump it with some air and like gonna auscultate that for that. An X-ray is really helpful as well. Wow, sorry guys, I was late on this. So you hear the air there, and you have a return of the gastric contact, so you're aspirating. 1 second, Rosemarie, I'm sorry. What pathological condition does non-pitting edema present? Lymphedema. Two physical, so know the imbalances listed on page 1306, super helpful. I can take it back. Two physical findings seen on legs when someone has stasis dermatitis. You're gonna see wheals, swelling, ulcers, swelling, and like purple-brown discoloration. Know the pulse points in the body. What are the two in the feet? You have your tibial and your pedal. Hi, baby girl. I'm so sorry. Look at you. Where's that pretty girl? You're so beautiful. List of liters of blood in the human body, 4 to 6 liters. And we are almost done. So it's going to ask you, are you getting hungry? So the units of blood in the body, So what's the relationship between red blood cells, hemoglobin, hematocrit? We didn't really talk about that much, so I'm not going to really ask you. But in case you want to know, red blood cells is like 1 to 3 hemoglobin to like, I don't know. Okay, so basically, if you have 4 red blood cells, you times it by 3, you have 12 hemoglobin. You times it by 3, you have 36 hematocrit. So it's times by 3. I don't know how else to explain that, but I hope that makes sense. I'm so sorry. Know the relationship between I'm not going to ask you about the points for different things. I'm sorry. Oh, let me actually do this one. So no relationship between hemoglobin and hematocrit. Hemoglobin is the protein containing red blood cell delivery of oxygen. And then the hematocrit is the measured volume of red blood cell compound with total blood volume. You don't really need to know that necessarily, so don't really worry about it. Are you okay? So, tasks and responsibilities of a nurse in charge of a patient with an NG tube. So, oh my gosh, are you okay? What's wrong? I'm sorry, guys. Are you okay? You're okay. What?
Can you pause that?
I don't know. I don't really think so, but it's okay. They're used to me having disruptions. Okay, so acid-based questions. So, responsibility as a nurse with an NG tube. Making sure the tube is patent, flowing freely and not plugged. You're okay, honey. Checking the tube frequently and that it's irrigating properly. It's secure to the patient. And that the NG tube is not causing necrosis in the nair. So you're always checking skin and everything like that with it. Okay, name the device and facilities used to shock hearts that have stopped. An AED. What is a rhythm that is always shockable? Ventricular fibrillation. So know your insulins. Sorry, we did not talk about these very well. So we're going to go over that right now. So a rapid acting insulin has the word log at the end of it. The crash time for the rapid acting insulin is 15 minutes. You give your, let's see here. So Lantus is a long-acting insulin, and they use about 2 units per hour of that. So there is not really a crash time with Lantus because it's such a long-acting one. So what are some symptoms of hypoglycemia? Low blood sugar. You're going to feel really sweaty, dizzy, tachycardic, loss of consciousness, all of that kind of stuff. And then, so why do they call it crystalloid a crystalloid? Because it's clear in color. And then, so let me see here. When to use the bell of a stethoscope versus the diaphragm. So the bell is that little part of it that you can like twist your stethoscope with. You're gonna try to hear low frequency sounds. So like gallops and rubs and murmurs, you're listening for that. And you also use that on like pediatrics. And then your diaphragm is the bigger part that you mostly use for everything else. And that's for higher frequency sounds. Okay, so what I want you to do as well, there's lots of math, and there is a matching for the heart rhythms. So review week 8, quiz 2 for lab, and you should be really good on those. That's a really good practice tool to review them with. And if you have any questions about anything, please let me know. You're gonna do great. Don't even worry about a thing. You guys are awesome. Again, I'm really sorry about all the interruptions. If you didn't hear me or have any questions, you know how to get a hold of me. Thank you.